Hello and good afternoon, everyone. Today, I'm really pleased to introduce our guest that we have invited over at the Masters Club. We have Dr. Yong Guan. He is a psychiatrist with his own clinic, Yong Guan Psychiatry, and also a politician under the Progress Singapore Party, also known as PSP. Now, Dr. Ang, a really happy New Year to you, and it's really nice to see you again. Now, I want to thank you for taking the time out of your busy schedule to speak to me. And before we start, perhaps I could invite you to introduce yourself to our peers who will be tuning in from Instagram and also LinkedIn.
Okay, I'm Dr. Yong Guan. I have been a practicing psychiatrist for the last 35 years. I graduated with the MBBS from local university. I went over to University of Edinburgh, Scotland to do my psychiatry, and I passed with a postgraduate qualification in 1986. Well, that's 35 years ago. And then I have been practicing psychiatry all these years, and I really enjoy my work, and I'll do my best to help people with psychological problems.
Well, thank you so much for the introduction, Dr. Ang. Well, I think it's safe to say that actually in the recent years, mental health has been a topic that is being conversed about a lot more. So I believe that when you open social media, be it on various platforms, we also see various healthcare institutions giving statements on mental health conditions, how do we cope with it? And also personally, in my experience, I've been seeing this word mindfulness appear a lot more commonly. So perhaps to start, Dr. Ang, maybe you could share with us and our peers what mindfulness is and how can it actually help in coping or combating mental health conditions?
Okay, mindfulness is actually an old concept. It actually is borrowed from the Buddhist tradition. And the idea is that you live in the present and then you, in a non-judgmental way, so that you can focus on possibilities, options, not trapped by the past and not worried about the future. So the whole idea of mindfulness is to live in the present. And this is a Buddhist concept taken from the Buddhist tradition. However, it went into mainstream psychology because of one man called John Kabat-Zinn, Z-I-N-N, John Kabat-Zinn. John Kabat-Zinn was a clinical psychologist at the Massachusetts General Hospital, and many therapists, many physicians with difficult patients, cancer patient, patient with chronic pain, patient with chronic problem, and the physician couldn't help them, and they would refer to John Kabat-Zinn. Dr. John Kabat-Zinn would take over these patients, and then he would introduce mindfulness to them to make them live in the present, tolerate the pain, tolerate their problem, and not to worry too much about the future and not get trapped by the past in a non-judgmental way. So the emphasis to focus on the present. And he discovered that many of them actually recovered from their chronic condition because after months and years of practicing mindfulness, they were able to live with their condition in a way. And then he went on to popularize it. And he also conducted what is called the 8-week stress reduction mindfulness course, based on mindfulness, how to reduce stress. And also later on, he went over to Europe, and the UK therapists went on to talk about mindfulness-based cognitive therapy. And that's how mindfulness came into the mainstream. And it has been there for the last at least 4 or 5 decades. And I find it very useful in helping my patients. So I come up with my own concept of what I call the 5-finger mindfulness, based on the acronym FOCUS, F-O-C-U-S. And it's linked to John Kabat-Zinn's definition. Focus on what? Focus on the present. Focus on positive. Focus on planning for the future. And stay calm, coming down through deep breathing, deep abdominal breathing. And then open your mind, open to many possibilities, because a closed mind, no options. An open mind, many options, many options. And then in a non-judgmental way, U is for unjudgmental or non-judgmental. And also the S is counting support from your friends, from your beliefs, and from your hobbies. So I use 5-finger mindfulness to share with my patient. And besides medication, we do a lot of mindfulness-based therapy. So that in essence is mindfulness. Focus on the present in a positive way, not dwelling in the past and not worried about the future, in a non-judgmental way, so that you actually enjoy every moment, mindful of the senses coming through, and then taking care of the senses so that you don't get overwhelmed by the senses and you can stay in control of the senses of what you are receiving. And that's the meaning of mindfulness, to be mindful of oneself, one's state of mind, and pay attention to that state of mind instead of worrying about the future or dwelling on the past. So that in essence is mindfulness.
Well, that's actually thank you so much for sharing. That's a really detailed and very comprehensive sharing of what mindfulness is. And I think I definitely understood that. But, I feel like based on mindfulness, there was no chemical component in it. There was no medications involved. And I feel like it really focused a lot on the behavioral and practicing of life of a human being. So I do think that not many people know that there is both a chemical imbalance portion, which is the psychiatry and medicational aspect, and also the behavioral aspect that does construct the entire possible triggers to mental health conditions. So maybe you could perhaps share a little bit on what this entire construct is on the chemical imbalance portion and how it can go hand in hand with our behavior and how we view our perspective on life as well.
Yes, there is. Let me have the model of the brain. This is the model of the brain. So there's the chemical aspect you talk about, and we know through MRI scan, those who practice mindfulness, they find that they can focus on the prefrontal cortex. This blue structure here is called the prefrontal cortex. Why is it called prefrontal cortex? Because it's in the front of the cerebral cortex. So it's a prefrontal cortex. In short, it's called PFC. So people who practice a lot of mindfulness, they seem able to have this active PFC, to have an active PFC. They seem to be able to focus, to concentrate, and to pay attention, right? So that is evident using MRI scan. Those who don't practice mindfulness, they tend to have thoughts all over the brain, and they tend to have what we call mind wandering, the mind wanders. And so practicing mindfulness is shown on the MRI scan to concentrate on the prefrontal cortex area. So there is a correlation between mindfulness and what goes on in the brain. And therefore, to understand your question, to answer your question, we need to do a short, give you a short session on the brain. The brain actually is divided into 3 layers, right? The first layer is called the limbic system. The limbic system is right in the middle, the limbic system. The limbic system, what does it do? It receives the 5 senses. So the limbic system is right here, comprising the thalamus, the hypothalamus, the amygdala, and the hippocampus. Some of us use amygdala to represent the limbic system. So we talk about the amygdala being the seat of emotion. But I prefer limbic system because it covers 4 structures. And then the 5 senses are picked up by the limbic. What we see, what we hear, what we smell, and what we taste, plus what we touch. When it comes to the limbic system, it has got 2 routes. It either goes up or it comes down. So when it comes down to the brainstem, there is no link to the cerebral cortex, right? There's no link to the cerebral cortex, and we can behave impulsively and irrationally. But if we are able to swing up to the cerebral cortex, especially the prefrontal cortex, then it'll allow us to reflect, to think about what we are seeing or hearing. So therefore, mindfulness is a way of allowing us to connect the limbic and the prefrontal cortex, the limbic and the prefrontal cortex. So when the prefrontal cortex is activated, 5 things happen. You can plan, you can organize, you can prioritize, you can control your impulse, and you can think of the consequences of your action. These are the 5 main functions of the prefrontal cortex. So it pays for us to link the limbic to the prefrontal cortex. Then you are in control of the situation. If whatever comes to the limbic doesn't reach the prefrontal cortex, then we call it a disconnect. You cannot connect the prefrontal cortex with the limbic. Everything will be transmitted through down the brainstem, through the spinal cord to the rest of the body, and you can behave impulsively and irrationally. So there is this short, if you like, short summary of the brain, the 3 layers of the brain. If you look at my background, you can see the 3 layers of the brain. I show the 3 layers of the brain on my wall as well. The limbic system, the cerebral cortex, and the brainstem. And I also do a little print out to show the 3 layers of the brain: the limbic system, the cerebral cortex, especially the prefrontal cortex, and the brainstem. So you find that if the 5 senses come to the limbic, pick up the limbic, processed by the cerebral cortex, the prefrontal cortex, and then store at the hippocampus. The memory store is M is the memory store, the hippocampus. And whatever is not stored is translated into behavior. See? So it can be 1A. 1A is reflective. We reflect. Or 1B. 1B is reactive. If it's 1B is reactive, it doesn't go through the cerebral cortex. It's reactive. And we don't want to have reactive action or behavior, because reactive we don't think, we don't reflect. So what we want to promote is reflection of the 5 senses. If you like to make sense of the 5 senses, if it's one line, it's to make sense of the 5 senses. So the cerebral cortex is able to make sense of the 5 senses. And if there is no cerebral input, then the 5 senses are just not well processed, and they swing down and translated into impulsive and irrational behavior. So the last point is that if there's a disconnect between the limbic and cerebral cortex, many things happen. We just heard impulsive, irrational behavior. You can have panic attack. You can have anxiety problem. You can have fear because you're not going through your cerebral cortex. And you can have obsessive compulsive behavior. You keep washing your hand. You keep checking because there's no cerebral input. There's no cerebral input. And you can get depressed because you're not able to objectively look at your situation or look at the event. And you can, if you read the event negatively, you get depressed. You can have mood swing. Even attention deficit disorder. You read a book picked up by the limbic but not processed by the cerebral. You can't concentrate. With limbic and brainstem, you cannot concentrate. You can only concentrate when it's processed by the cerebral cortex. And you can get paranoid, paranoid disorder. You look at something not processed properly, you misinterpret that event, and then you think that people are after you. People are coming after you. Or people try to poison you, or people listen to your conversation and try to manipulate your life. So, and this is the meaning of schizophrenia. Schizophrenia is a split between thinking and feeling. You can't think appropriately because you're not receiving information from your limbic. And if there's a split, it's a split between the thinking and the feeling. Okay, and because of various reasons, we don't want a split. We don't want a disconnect. A disconnect gives rise to many problems, mental health problems. What we want is proper connection. And if you like, mental health is about connecting the limbic and the cerebral cortex at the brain level. At the brain level is connecting the limbic and the cerebral cortex. That is one definition of mental health or mental stability, if you like. So that covers the biological model. And then you have the psychological model. The psychological model is about what you store in your memory store, right? Some people are unfortunate. They store a lot of negative memories in their memory store. History of being traumatized when you were young. History of abuse when you were young. Difficult relationship with their parents or with their caregivers. All these will be stored in the memory store as negative memory. And it can affect their behavior. It can affect their feeling. They always feel not enough, not good enough. They always feel something is missing in their life. They look down on themselves. They don't feel good. They have low self-esteem. And they always look for external validation. People must validate them, praise them, then they feel good. And then they are afraid of making mistakes because of their low self-esteem. They feel insecure. They are afraid of making mistakes. We all learn from our mistakes. So a person with high esteem and feel secure would welcome mistakes because they learn from their mistake. But if you are insecure and with low self-esteem, you avoid making mistakes. And you have fear of failure, fear of making mistakes. So to sum up, there is a biological model, right, which is largely genetic based.
Yes.
And then there's a psychological model based on your experience in your growing up, that kind of attachment you have with your caregivers, and that can psychologically affect you. So you have the biological model, and then you have the psychological model.
Wow, thanks so much, Dr. Ang. Yeah, that was a really comprehensive description. And yeah, I think, there's one interesting thing that kind of spoke out to me while you were explaining that model, was that I feel like when in general, like the public, because we do not know this information of like the whole chemical and the biological model. So what happens is that, from the feedback that I've been getting, lots of people would categorize that illnesses such as, depression or panic attacks or anxiety attacks, which are more common. We see more people dealing with this, or it's more spoken about. It's less severe, or it's in a different category from illnesses such as bipolar or schizophrenia. Would you say that there is a distinction? Because from what I'm seeing from your diagram, it's just a different output, but it stems from the same origin in terms of a biological standpoint.
Absolutely right. Therefore, when you have a disconnect, many things can happen from mild to severe. The panic attack, the anxiety, the fear are what we call neurotic problems.
Okay.
Neurotic in the sense that it's to do with tension. You have tension in your body. So it's about anxiety, it's about feeling tense, feeling panicky, feeling dysphoric. You're not calm, you're not happy. There's a lot to do with tension. But then the severe ones will be what I call psychosis, not neurosis anymore. Neurosis is tension, anxiety, panic. Even OCD is a form of neurosis. You keep washing your hand. You feel not good enough. You're not clean enough. You keep washing your hand. But then there's another more severe one due to, if you like, the disconnection is wider. There is a wider disconnection leading to a very severe problem we call psychosis. Okay. So psychosis is characterized by DHL. D is for delusion. They're so psychotic that the cerebral cortex is upside down. And then they have false, unshakable beliefs, not in keeping with their social, educational background. For example, believe that he is a world champion in boxing when he's not in keeping with his background, and keep maintaining that he's the world champion in boxing. So there's a delusion. For example, I want to take a spacecraft from Changi to the moon. We know Changi doesn't have spacecraft. So that's a delusion. Then you keep telling him, no lah, Changi got no spacecraft to the moon. He said, sure, there is. You haven't seen it. Let me bring you and show you a spacecraft. That's a delusion, right? Then you have hallucination. If you're disconnected, voices come in and disturb you. You can see things which are not there. That's hallucination. You can smell things when there's no such smell. Or you can taste some funny taste when actually it's not that funny taste. You eat food and then everybody thinks very, very nice food, but you keep saying this food tastes terrible. Somebody's trying to poison me. This is the food that is contaminated. But everybody say no, it's not. So you're deluded and you have hallucination about the taste of the food. And touch as well. I have patients complaining of insects crawling all over their body when there's no such insect. So this sensation, tactile hallucination. So the 5 senses can be distorted in the form of hallucination. And lastly, what is L? Because they are not connected and they're psychotic, they have loss of logical thinking. The thinking is no longer logical, upside down. Used to be like that, now it's upside down. So they have illogical thinking, irrational thinking. So loss of logical thinking. And because they're disconnected, loss of touch with reality. They are out of touch with reality. And that is the definition of psychosis. Psychosis is delusion, hallucination, loss of touch with thinking, loss of logical thinking, and loss of touch with reality. Only psychotics have DHL. Neurotics don't have DHL. Neurotic have tension, lots of tension, but they don't have delusion, don't have hallucination, don't have loss of touch with reality. They are very much in touch with reality, too much, because they're all tense up. Tense up. So that is a very simple distinction between neurosis and psychosis. In terms of severity, a neurotic patient can have a very severe OCD, a severe panic disorder, a severe anxiety disorder. So in terms of severity, I would say that it depends on the illness and the support the person is getting from his family, from his friends. So let's put severity aside, but let's concentrate on neurosis and psychosis. And I have a diagram to share regarding this. And this is a diagram I want to show. Can you all see this?
Yes, absolutely.
So you can see psychotic disorder is very high up on this hierarchy of mental disorders, followed by bipolar disorder. And then you have the depressive disorder. Your anxiety disorder definitely are neurotic disorders. Your psychotic disorder will have DHL. Bipolar disorder, if they're highly manic, they can have delusions of grandeur. They think they can control the world. They think they control the world. They think they are able to change the world. No? They have these grandiose delusions. Then you have depression, anxiety. There are 5 anxiety disorders: generalized anxiety, social anxiety, panic disorder, phobia, and one more is agoraphobia, which is not inside here. Basically fear of enclosed space and fear of open space. And number 6 is OCD, very common in Singapore. 1 in 33 Singaporeans have OCD. In America, it's 1 in 40. In fact, many years ago, there was an article in the Straits Times stating that Singapore is the OCD capital of the world. The whole world, we have the highest number of OCD, 1 in 33. OCD capital of the world. I remember the article very well, and I have a copy of the article. 1 in 33. That means in every class of 33 students, 1 is going to have OCD. And OCD is they wash their hands, they check and recheck. They hoard things, and then they are very fussy, or they can be obsessed with certain thoughts, ruminative thoughts. And number 7 is stress-related disorder. You have adjustment disorder, you have acute stress disorder, and PTSD, post-traumatic stress disorder. Again, very common for those who have an experience of a traumatic experience. They can develop PTSD. But remember, not everyone will have PTSD when they have a very traumatic event. Somehow those who are vulnerable are those who have got difficult childhood, history of anxiety, history of depression. They are prone to PTSD. Then you have eating disorder, common among growing up female teenagers. You have sexual dysfunction, you have impulse control disorder. Number 9 is addictive disorder. And the last one, number 10, you have personality problem or personality disorder. All of us, we all have a personality, but we may not have a personality disorder. Personality disorder, under the diagnostic criteria, there are 10 personality disorders, but we all have personality problem. Okay, we have our weaknesses, we have our strength, we know our quirks, our special likes and dislikes. And that's called personality issues or problem, but not a disorder. Now I put it as number 10 because if you have personality problem or personality traits that you are not able to resolve, it can lead you to develop depression, lead you to anxiety problem. For example, if you are a worrier and a perfectionist, you have non-stop worrying and you want things to be perfect, okay? And you discover that life is not perfect. You discover that you cannot stop worrying, right? You are a worrier, you are a perfectionist. So you would run the risk of becoming depressed and becoming anxious, developing anxiety disorder. So our personality problem can lead us to develop neurotic problem, so-called anxiety or depression. So I would stop here. This is just to give you an overall view of mental disorders.
Okay, well, that was a really comprehensive breakdown, Dr. Ang. Thank you so much. Well, I have prepared a poll by our postgraduate students over at NUS, just in preparation for our dialogue today. So, we kind of sent out this poll to get some feedback on the overall awareness of mental health, some of the things that you were talking about, what are their emphasis of good practices towards mental health in their life, some of the illnesses that they're aware of, and social stigma. Well, I just wanted to share with you the top 3 illnesses or mental health conditions that our students have encountered with. Actually, number 1 is depression, 2 panic attacks, and 3 anxiety attacks. So I think these are all considered neurotic conditions, as you explained earlier. So yeah, so Dr. Ang, could you actually share, what might actually be some of the more severe or major triggers that could particularly trigger a neurotic condition other than what you were saying earlier, which is a personality, trait as well?
Okay, I think what is a stable person? What is a person who can handle stress well? How do we define stability? How do we define wellness? I always mention the 4 legs of a chair, the metaphor I use. Mental health is one of the 4 legs. We have to be physically fit. And then we need to socialize, social health, because we don't live by ourselves, we live with other people. And the last leg is a spiritual leg. And for those in religion, it will be the religious leg, your relationship with God. So we can't run away from the four aspects of health. In fact, the World Health Organization defines health as not just merely the absence of physical symptoms. It also says you need to have mental health, social health, and spiritual health. So it's not enough to say, I don't have cough, I don't have fever, I don't have chest pain, I'm healthy. You are physically healthy. You are not totally healthy. Total health or wellness must cover three other aspects: mental, social, and spiritual. So that is a kind of a broad definition of wellness. How do we develop the four legs of a chair? In my opinion, is partly to do with how the brain is endowed with the genetic factor, the biological factor, and also partly the psychological factor, how we are brought up. And in the process of growing up, one word strikes me as very important, and that word is attachment. How our caregivers engage us, how our caregivers provide secure attachment. You will grow up in a very tense family environment where your parents are quarreling every day, where your father is a drinker, comes home, bash up your mother, and you live in fear. As young as 5 or 6 years old, you live in fear. I remember you live in tension.
Yes.
And if you live in fear and you live in tension, it is if you live in fear and tension, it is very difficult for you to have secure attachment to your caregivers. And if you don't have secure attachment to your caregivers, what happened to your sense of self, your self-image, your self-identity, your self-worth will be affected. And what happened is you will have a low self-esteem. You will feel insecure because you never had a secure attachment, and you develop low self-esteem. And with a low self-esteem, you become more prone to neurotic problems. You're so used to tension, and then it's very easy to feel tense throughout your growing up and your adult life. And then you become more prone to neurotic problems, such as depression, panic attack, or panic disorder, and anxiety disorder. So the whole idea is that take care of the period when we're growing up. Now, assuming you didn't have a chance to have secure attachment, it all is not lost. You can rebuild your esteem, rebuild your sense of worth in your later years. How? Social health, through your interaction with friends. Spiritual health, through your relationship with God, if you believe in God. If you don't have a God, then your belief in your own capability, your belief in your hobbies. Because if you have hobbies, the hobbies can help you grow, can help you feel secure. Because hobby, by definition, is something that can lift you up. Of course, not a hobby like a negative hobby like gaming, excessive gaming, or excessive drinking or smoking. Those are what I call negative habit. We're talking about positive habit that can lift up your spirit. And of course, things like meditation, yoga, sports, exercise, all these can help you build your sense of worth, your sense of self. So the damage that you encounter as a growing up child or adolescent can be repaired if you happen to meet people who can help you grow and develop. That's why I talk a lot about transformational relationship. If you meet somebody who can help you transform, help you grow, the four legs of a chair, help you grow, There's transformation taking place. You grow, I grow, we grow together. And I would say transformational relationship is not readily available. You got to look for it.
Absolutely, yes.
Most people are in a transactional relationship. How can I benefit from you? What can I gain from you? What is it that I want you to do for me? You know, how useful you are to me. That's transactional relationship. Transactional relationships do not build self-esteem. Because you're made use of, you're being made use of, right? What we want is transformational. You grow, I grow, we grow together. That's the power of what I call the 5-finger mindfulness, because it's to help you grow, help you open your mind, help you free yourself. If you are trapped, there is no mindfulness. When you open your mind, there is mindfulness. And then you can engage other people whose mind are equally open. If you meet somebody whose mind is closed, then you're going to have problem. If both minds are closed, there'll be clash. There'll be clashes. So what we want is open mind, dealing with people with an open mind, and that's transformational relationship. So back to your question, yes, depression, panic attack, anxiety, they are common in our country. But why are people prone to it? Low self-esteem, sense of insecurity. How do we repair it? Build the 4 legs of a chair: social, physical, mental, and spiritual, and look for transformational relationship. Then you find yourself growing and developing. My favorite model is the do, learn, grow model, right? I will share with you my model of attaining wellness. I will do some slide sharing now. Attaining, there you are. Can you see the 4 legs of a chair?
Yes.
This is what I call the 4 legs of a chair: mental, social, physical, religious, or spiritual. Okay, we have gone through this already. So the mental state, intellectual and emotional. We want intellectual development and emotional development. And intellect is the brain, it's a cerebral cortex. Emotional is the limbic system, deals with emotion. The amygdala deals with emotion. And they say wisdom is when your intellect is well connected to your emotion.
Wow, okay.
If you are very intelligent, but your intellect not connected to your limbic, not connected to your emotional system, emotional brain, you are very intelligent, but not wise. A wise man is intelligent and emotionally well regulated, emotionally very healthy.
Wow.
I would rather be wise than to be very intelligent. In fact, more intelligent, but I may be very intelligent, but I may not be wise, because my intellect is not connected to my emotion. Okay, so that's mental state. This is the do, learn, grow model. Everybody wants to do well in life. That's a given. We want to do well in life, and then we want to learn better, smarter way of doing things. So I always say, lifelong learner. I'm a lifelong learner. This morning I watched 2 TED Talks, and I love it very much, because one is about a man who travels a lot, right? His name is, I got his name here, Nick Martin. Nick Martin. He's 31 years old. He started traveling at the age of 24. For last 7 years, Nick Martin has gone to 70 countries.
Wow.
Visited 70 countries. And he learned a lot about 70 countries. He's 31 years old now. He has given a TED Talk, and he has started a movement called, learning and, learning through traveling. And look, if you are exposed to 70 countries, you're exposed to so many different cultures, of course you will grow wiser. And remember, the 4 legs of a chair, right? You grow physically, socially, mentally, spiritually or in your religious pursuit. So this is my do, learn, grow model, the do, learn, grow model. And I always use, when I put my two hands together, the do is the apex of the pinnacle, the pinnacle, the apex of the triangle. And what we do is visible to the world. What we do is visible to the world. Like all of you are watching me now, you are listening to me now. I'm performing, I'm doing. But the learning and growing, the learning and the growing is behind the scene. This morning, right? I told you I saw two TED Talks. One is by Nick Martin, and another one is by Dr. Kang, K-A-N-G. Shimi Kang, S-H-I-M-I, K-A-N-G. She's a psychiatrist with 17 over years of practice, and she spoke a lot about one life skill that to her is very awesome, and that life skill is adaptability. The entire TED Talk watched by 3 million people is about adaptability, and she went on to back her findings, back her point with a lot of findings, and she also talked about the importance of mindfulness in that talk. That's me. I learn and grow. But what I have learned is all in the background. This morning I watched the two TED Talk, right? It's all in my background. But I can share now. Whatever I learn and grow will enhance my performance, right? Whatever I learn and grow will enhance my performance. You can see, I have introduced two TED Talks to you, right?
Yes.
Enhance my performance. So that is the beauty of the do, learn, grow model. Then we want to develop ourselves, right? So the self. And how do we develop ourselves? The 3 A's. We want to appreciate our weakness, our strength. Remember earlier on, I talked about personality weakness. We want to know what kind of attachment we have when we were growing up, right? We want to know what kind of insecurity or what kind of issues affecting us. So we appreciate our weakness, our strength, our station in life, appreciate ourselves, okay, basically. And then we want to accept what we cannot change. And whatever we can change, we'll try to do our best. Acceptance is very important. Lady Gaga was recently interviewed by Oprah Winfrey. She talked about cutting herself, right? She talked about how she was isolated when she was young, how she was bullied when she was young, and how she was raped when she was 19. And all these remain in the memory, but not processed. So she was not a happy person. And she had fibromyalgia. Her whole body was full of pain for 5 years. She went to many doctors. None of the doctors could help her until she went to see a psychiatrist. The psychiatrist told her, this is due to your underlying insecurity, your underlying esteem problem. You may be very confident as a singer, as a dancer, but inside your esteem is not as high as your confidence. I want to share with your audience here, we can be outwardly very confident, doing very well, but inwardly our esteem may be slightly lower than our confidence. In my practice, I've come across many such examples. Outwardly very confident, inside full of doubts, self-doubts, poor self-image, poor self-identity, always feeling not good enough, always want to compare, always want to compete, always must win, always feel must be perfect. When things are not perfect, they cannot take it. That is not high self-esteem. Always depend on what people think of him. That is not high self-esteem. So Lady Gaga, full of confidence, but lowish self-esteem. And she told Oprah Winfrey, I radically accepted my lowish esteem, insecurity. I accepted what the psychiatrist say, and I would change. And what happened? She adapted to the advice of the psychiatrist. So she took medication, olanzapine. Olanzapine is for psychosis. She took olanzapine to help her connect. Olanzapine come to the cerebral cortex and help her connect. And she was taking what she called an unorthodox set of pills. You don't give olanzapine except to a psychotic. But she was so troubled. Maybe she needed the olanzapine, the Zyprexa, to connect. Then she practiced meditation. She went for talk therapy, psychotherapy. And the main therapy she went through with dialectical behavioral therapy, DBT. And the main component of DBT is mindfulness. So if I urge your audience to take a look at the interview. It's about an hour long. A very good interview between Lady Gaga and Oprah Winfrey. And you will learn a lot. Why? Because she radically accepted her diagnosis. She was not in denial. Remember, people can be in denial. When you are in denial, you cannot change. You cannot adapt. You cannot grow. So remember, she accepted and she grew. She said, I'm so happy. I'm so grateful to my psychiatrist who managed to come up with a treatment plan for me. So to the audience, Jeremy, this is to tell them the self is the core. And what are the three things you need to know? A, the 3A battery. Appreciate, accept, and adapt. Appreciate, accept, adapt. So this morning when I heard Dr. Kang's talk, and she said, there's only one skill to make your life awesome. And that skill is adaptability. I say I've been preaching adaptation for years. So you can see nothing is new under the sun. Yes. You can see that many of these skills I'm sharing are actually universal. And many of the things I talk about is commonsensical. But we need to make sure we are able to synthesize the common sense and gain from the common sense. No point having a lot of common sense, but you're not applying it. We need to apply our common sense. Okay. Then the next step is others, right? Others. Appreciate, self, adapt, or act. Then the next is others. Appreciate others. Very important. We get along with others. In fact, mindfulness is about yourself. Mindful about yourself. Mindfulness about others, they call it a new term. They call it mentalization. Mindful of others. Because in the West, you need to coin new term, new therapy, and then you publish paper, and then you have your tenure secured. So mentalization-based psychotherapy, basically, to me, is about the big picture, appreciating others, and accepting others, and then adapting or act on your understanding of others, or adapt. I prefer adapt, act and or adapt. So the second circle is others. And then the last point is the role we play. We must be mindful of the multiple roles we play in life. Right now, I'm helping, I'm sharing, I'm teaching, right? But at home, I'm a father, right? I'm also husband to my wife. Then when I visit my parents or my father, I'm a son, right? Son to my father. We all have different roles. Again, the 3A, appreciate, accept, act, or adapt to our role. So to the audience, I would say that this is my model, the do, learn, grow model. 3 points of the triangle, 3 sides of the triangle, and 3 concentric circles in the middle. All together 9 points. You can add on, but these 9 points, in my view, actually is enough to build the 4 legs of a chair: social, physical, mental, and spiritual. So that in summary is my do, learn, grow model. Okay.
Well, yes, Dr. Ang. Well, actually, what you said was definitely very true because with our poll, like what we were talking about earlier, of why we did ask students, what do you think are the biggest triggers or biggest contributors to getting like the neurotic mental health conditions? And the top two answers was stress, which is you were talking about tension, and family background. So I think the family background is like what you were saying earlier. Did they grow up in a environment where with fear and there was a lot of tension, and this would lead to what you were talking about earlier, which is self-esteem. And I think that was excellent sharing about the confidence aspect, where someone can appear to be very confident, but have low self-esteem. I mean, I did not know that about Lady Gaga. I knew that she was going through certain things, but to hear that she's an amazing performer. I mean, if you watch her live videos on stage, you can't even imagine that someone like that has low self-esteem, which is really amazing. And Dr. Ang, I'm not too sure if you're familiar with dog training. So I speak to one of the dog trainers in Singapore, which was the winner of the Cesar Milan Asia Recruit Challenge. And one of the things that he talked about, it is present in dogs and it's also present in human beings as well, is he talked about perceived confidence. So I think this is similar to what you're saying, where someone can appear to be very confident, or in a dog's case, it can appear to be very fierce, to be very intense. When actually deep down, the root that it's just a symptom of showing this behavior, when deep down it's coming from and stemming from insecurity or fear. So I think this definitely is very true, and it was a very interesting sharing by you. And I have to also say that
I got two dogs. Jeremy, I got two dogs.
Oh wow!
I got
very
two
cute.
dogs. And Emma, exactly what you say. Emma will bark and bark and bark if there's a stranger at the door. Dante is like a Zen Buddhist, very quiet, very connected to her, his inner self, right? Yes. This one would have outer display of confidence, barking very loudly, but actually is a very gentle lady. This is a gentleman, this is a gentle lady. But you're right, perceived confidence. And everybody is so scared of her, but actually she can bark, but doesn't bite.
Yes. Well, it's very cute and sweet that you have your dogs printed out and laminated picture. Yes.
Yeah, laminated. Yeah. When I tell my patient will share with me their hobbies. Mm-hmm. The moment they talk about dogs, this thing will come out.
Oh wow, that's very sweet. Yes.
And I also talk about personality differences.
Mm-hmm.
You see the difference, even between two dogs, you can see the difference.
Absolutely.
Yeah. One is so quiet and one is so rowdy.
Yes, and also I have a dog as well. His name is he's a Japanese Spitz. So I get what you mean by the personality. They are like exactly like human beings in the difference of personality. And one of the things that you talked about earlier, which I really did resonate with, was that I'm really thankful to have transformational relationships that I've met during my master's journey in NUS Business School. I have friends who I definitely did grow and learn a lot from. And earlier you were talking about the tech talk that you attended this morning by the Traveler, and I just came back from Nick Martin. Yes, thank you for reminding me. Well, I just came back from Switzerland and Germany after New Year's, and this was a trip where I realized that learning and perceiving and absorbing new cultures, learning how new people live, how they communicate, the food they eat, and different lifestyles, and kind of trying to take what is good from their cultures and combining it from what is good from our culture. I think it's something that should be practiced more instead of like we were talking about open minds. I think that definitely is
open mind.
Yeah, absolutely. So actually, Dr. Ang, I know that you did up your slides, and before we move on to the questions that some of our classmates and peers have posted, is there anything else that you'd like to share with us in terms of mental health, mindfulness, or anything that you found important that you wanted to talk about?
Okay, I alluded to mentalization just now.
Yes.
So I would like to show what is the difference between mentalization and okay, maybe I just before I go there, I just want to talk about, remember we talked about the biological aspect, taking care of your brain, right? since we have the diagram here, remember the limbic system picked up the 5 senses, processed by the prefrontal cortex, and then store in the memory store. And what is not stored will be translated into behavior. So your audience may want to have this slide, and then they can keep this slide, And then brainstem. The brainstem takes care of eating, sleeping, and breathing. So in my view, taking care of the brain, especially the brainstem, eating properly, eating well, and sleeping well, easily 7 to 9 hours, no short chaining. And breathing is through your exercise. If you take care of these 3 aspects well, wow, next day when you wake up, you'll feel good, and then you will be able to think clearer. So don't shortchange on the 3 basic functions: eating, sleeping, and breathing. That's the message as far as the brain is concerned. We talk a lot about self-care. Basically, self-care, in my opinion, is in the area of eating well, sleeping well, and breathing in the form of exercise. If you can't take care of yourself in these 3 areas, it is very hard to take care of others. So that's basically the 3 areas. Okay. And then this is the book I highly recommend to the audience. This is by Carl Newport. It is about how to live in a focused way, in a distracted way, in a distracted world. I found this book several months ago, and I fell in love with this book because it's basically about when you do deep work, how you put your gadgets aside, how you put your gadgets aside, how you draw a line, and put your gadgets aside, because we are all a zombie, zombified by our gadgets. If we don't draw a line and schedule distraction, that means 7 to 8 I will study. At 8 onwards, I will touch my iPad, iPhone, look at my email. This is a skill, to me, a life skill, a lifelong skill. If we can draw a line when we do deep work, we are able to succeed in life. We're going to be very successful in life because all of us become slaves, slaves to our gadgets. Jeremy, have you come across this book?
No, I've actually not seen it. This is news for me. Yeah, this is my first time seeing this. Yes.
Then we need to schedule deep work ritual. For me, it's every morning, 7 to 8, deep work, 1 hour. And then there's shallow work. And then this book says, if you can do 4 hours of deep work per day, wow, it's fantastic. Wow. Most people 2-3 hours. 4 hours of solid work divided throughout the whole day. 1 hour of deep work followed by 1 hour or 1.5 hours of distraction. You can do anything you want. After 1 hour of deep work, you can do anything you want. And it's not asking much, it's 4 hours in a day, not asking much. All right. And then, this is very important. When you do deep work, what happens is that myelin is formed, and myelin protect your neuron. What is myelin? Myelin is the covering. I use this ball pen. Myelin is the covering of the neuron. So if you have thick myelin, you protect your neuron. And when you protect your neuron, you have a strong brain. Your risk of dementia will be very low. Your risk of developing neurotic problem will be very low because your brain, because of deep work, your brain somehow forms myelin. In other words, you are myelinated when you do deep work, right? So there is a biological basis for deep work. Just now you asked me about the brain, the biological as well as psychological. Biologically, when you do deep work, myelin is formed, all right? And then you have the point about deep work, you must sleep well. Every evening, don't bargain with sleep because you must have an evening shutdown, 7 to 9 hours. And one of the problem modern men face is screen time. Before they sleep, they look at the iPad, the iPhone, the computer. And what happened when you look at all these things, screen time, your melatonin is reduced. We need melatonin to sleep. We don't want to eat oral melatonin to sleep now. We want the natural melatonin. And the natural melatonin can only come out if you don't look at the screen for at least an hour or more before you sleep. Cut out screen time before you sleep. And once you cut out screen time, your melatonin go up. You have sound deep sleep for 7 to 9 hours. Next day, you're ready for deep work. So the third point is you need to have evening shutdown. I have many patients who ruminate, their mind goes ruminating before they sleep. They can't sleep. So Carl Newport suggests you write down your unfinished tasks and your action plan for the next day. You commit on paper. When you commit on paper, you are parking it one side. I call it, you're parking your problem one side. You're not allowing your problem to disturb your sleep. You park it one side. Tomorrow, you take it out and take a look. You can take a look. Many of us go to sleep with the problem, in our mind. It's not parked, it's parked in our head,
Yes.
Not elsewhere, but in the middle, and it affects our sleep. You park it one side, park it one corner of your brain, one corner. Then you can have deep work and deep sleep. Deep sleep. You can have deep sleep. Okay, so that's deep sleep. Back to your point, Jeremy, you need to take care of your mind. We don't know where's the mind. We know where's the brain. We know this is the brain. But the mind, we don't know where's the mind. The mind is an abstract concept, right? So psychologically, we take care of our mind. And for viewers who are interested, living mindfully, remember the do, learn, grow model, you can email me. I will be more than glad to send you a copy, a soft copy of my little booklet on the 5-finger mindfulness. Okay, there you are. These are the 5 steps. Step 1, 2, 3, 4, 5. Okay, I will not go into detail now. I go straight to. Remember? Do you remember Lady Gaga interviewed by Oprah Winfrey, and she talked about wisdom.
What has been the lesson that's actually taken you the longest to learn?
How to be wise.
Oh,
See, there is the rational mind.
Rational mind.
And there is the emotional mind. And I think from day to day, we all experience ourselves, if we're mindful in some type of way, which I think this is good to be mindful about, is am I operating from an emotional space today or from a rational space today? Meaning, when I say rational, I mean cerebral, like intelligence, thoughts, facts, just really pragmatic. And emotional meaning like, am I operating from the heart? And wise sits in the center. Wise is when you are both rational and emotional at the same time, and those two things meet.
You become wise.
And you become wise. And that was the lesson that I learned. I mean, and then he ordered a medication for me that I took reluctantly at first. And then he became my psychiatrist and assembled a team for me. And I went away to a place that I go to sometimes still for like a reboot.
yeah.
And they took care of me. And we got all of the things lined up. And I have a very unorthodox, actually, set of pills that I take. But they saved my life. And I'm very grateful.
You use medication, but you also do many other things to keep yourself spiritually sound and
Yes, so
centered.
I meditate.
Yeah.
I do transcendental meditation. I do talk therapy, dialectical behavioral therapy.
Indeed. Lady Gaga.
So amazing for her to admit her problem and for her to get help. Fantastic. Mentalization. Remember, mentalization is how to be mindful of others. You can Google this. It's all over the place. And there are 2 men famous for it, Peter Fonagy and Anthony Bateman. So what is mentalization? Mentalization is basically an attitude, perspective, right? If you look at this, it's raining, it's drizzling, the ground is wet, the child is dancing with an umbrella, and the grandmother or the mother is enjoying the dance with her. So there's a lot of mentalization taking place. She is putting herself in the little granddaughter's mind. Since she like it, since she's enjoying it, let me join, let me dance together with you. And that's what we call mentalization taking place. If assuming she's not interested in dancing, she wants to wait for the sun to come up, wait for the ground to be completely dry, right? And then the granny say, no, don't worry, it's okay to dance now. There is no mentalization. And similarly, if she wants to dance, and the granny say, no, you can't dance, it's wet. Wait for the sun to come up first, then we dance. There is no mentalization. So be careful. Mentalization is a way of building self-esteem in a child. Mentalization is to make the child feel understood, make the child feel good about herself. If we impose our values on the child without listening to her views, we are actually forcing down our values on her. So in mentalization, we want to hear what the child has to say. If the child says, no, Amma, I don't want to dance, I want to wait for the sun to come up. And then Amma says, sure, no problem. We'll wait for the sun to come up, no problem. So it has a lot to do with attitude and perspective, right? And then there you are, the double helix. On the one hand is mindfulness, all right? Mindfulness is micro. We want to connect the limbic and the prefrontal cortex. And mindfulness is one technique of connecting A and B, right? Connecting A and B. And mine is using the 5 finger to connect. So mindfulness is internal, within yourself. But in mentalization, you are not alone. Mentalization is interacting with someone else, mindful of others, is mindful of others. And one of the key person who has done a lot of work in mentalization is Anthony Bateman.
And that's what the mentalizing process is.
Yeah. Anthony Bateman, that's what the mentalization process is.
It's understanding both ourselves and what's going on in our mind.
See, understanding ourselves, what's going on in our mind, in a sense, mindfulness. And then the next step.
That's what might make us do things.
What make us do things? That's first step. And then the next step.
And actually, when we're with someone else, what makes them, what's going on in their mind?
This is mentalization. When you're with someone else, what's going on in the person's mind? When the grandmother is with the granddaughter, right? What's going on in her mind? Does she want to dance now, or she wants to dance later? You get the idea?
Yes.
Then if she wants to dance later, it's fine. You know, I mustn't force it onto her. That is mentalization. Okay.
That makes them behave or ask the questions they're asking.
Mentalizing is the ability to mind other minds.
This is mentalization. Mind others' mind, to be mindful of others. In a way, transformational relationship. You want to transform that person. You want to know, in a way, it's empathy, but more than empathy. Empathy is just putting your shoes in that person's life, but you want to know what is making the person the way behave, the way he or she behaves. What is in the mind of that person?
It's to understand misunderstanding.
Beautiful. When you're mindful of others, you clear the air, you clarify. Understand misunderstanding. Hey, I thought you want to dance, you want to wait for the sun to come up before you dance. No, Amma, no, I want to dance now. I enjoy dancing now. So it's clearing the misunderstanding. Hey, but last time you dare not dance when it's wet on the ground. Oh, Amma, different now. Now I'm taller, I'm bigger. I would like to dance now. It's clearing the misunderstanding.
And to see oneself from the outside and others from the inside.
This is beautiful. The ability to see yourself based on feedback. Remember, do, learn, grow. We want to grow. And the only way to grow is when you have feedback. And then see others from the inside. How you observe others. See others from the inside. Yeah? So actually in my 5-finger, step 2 and 5 has a bit of mentalization already. You look at step 5, connecting with people, connecting with others. And mentalization is a life skill throughout the rest of our life. So I will pause here basically to say that mentalization is a very important skill. And if I can value add to your audience, that is something that is new. Besides deep work,
Yes.
you have mentalization. So they can, it's not this, Dr. Ang is saying basically the same thing. We already know. I think we want to add value so that they don't waste time looking at the recording.
Okay, well, thank you so much, Dr. Ang. That was, wow, really. Yes, I think that when you broke it down step by step in terms of the focus and mentalization, it is definitely important. And I feel like sometimes we might get caught up in our personal ambitions or what motivates us that we might forget to practice good mentalization, especially I think like what you were saying with the example of a grandmother, your ama with the granddaughter. And sometimes as adults, you're caught up in the pragmatic side of what is logical and we forget what does that other party want, that is not in regards to my needs. So that was definitely very good sharing. And one of the more important aspects that I wanted to talk to you or get your opinion about was I believe it's a big obstacle in the acceptance of mental health conditions, and also for patients to step up to get treatment. It's social stigma. So I believe that social stigma it has improved from the past. However, I still do believe that in Singapore, there is some sense of social stigma towards mental health conditions. In our poll with the same group of students that we reached out to, we asked them if they would be comfortable with seeking medical treatment and help if they were to experience some sort of mental health conditions. And about 55% said yes, while 45% said no, although majority said yes. But do you have any suggestions of what we could do as a society, be it as a friend, partner, relative, to kind of also to help to remove or reduce this stigma and increase willingness to seek treatment?
It's a very good question. 55 versus 45, that means in the middle, it's roughly half. And I think it's not good enough. One of the problems is that in physical illness, we can see objectively what's wrong with the body. If you have a fracture of your leg, it's obvious it's shown on the X-ray, and we can fix it. We can do something to it. If you have pneumonia infected by a bacteria, we can take X-ray, we can see it, and then we can use antibiotic to kill the bacteria. So physical equals objective, mental, non-objective. We have no blood test, we have no scan to show that you are having panic disorder, or you are having OCD, or you're having schizophrenia. So that is our difficulty. And because it's not objective, then there's a issue of, it's all in your mind. It's all in your mind. It's nothing to do with the brain. It's all in your mind. Anything to do with the brain is medical. Neurologists take over. Anything to do with the mind, well, you see a psychiatrist, what can he do?
That's a very good.
Ask you to, he just asks you to exercise, eat appropriately, sleep well, 7 to 9. What else can he do? What he can do, I also can do for you. So a lot of people avoid seeking help. IMH has done a study in 2016. People with anxiety disorder, sometimes it takes them 2 years before they really seek professional help. And even in OCD, it can take up to as long as 9 years before they seek help. Because OCD is like tolerable, if you keep washing your hand, except for the high PUB bills. The high PUB bills, people tolerate the washing of hands. You check, never mind, let you check. Before you leave the house, you check the door 5 times, let you check. So the tolerance level is very high for neurotic conditions, especially. And therefore, they say, no need to see psychiatrists. It's your behavior, it's your personality. You are very fussy. You wash your hand more times than others. So because of these few reasons, people are reluctant to seek psychiatric help. And then there's another reason. The patient himself, the person himself may think is weak to see a psychiatrist, or may think that I'm not crazy, why should I see a psychiatrist? So we need to remove certain myths. And one of the myths is that you don't have to be mad to see a psychiatrist. You just have to be a bit neurotic, a bit tense to see a psychiatrist. And basically, if you go back to basic, why do we go to the gym? We go to the gym for physical fitness, right? So please come forward. You don't have to see a psychiatrist straight away. See a counselor, see a psychologist first, especially if you don't need medication. You come to us if you feel that you need medication. You feel that your problem is very serious, and you find that the counselor or the psychologist cannot help you. So don't always think that we treat mad people. We say they're psychotic, but psychotic, now we have so many valuable medicine. We have a lot of medicine that can go to the cerebral cortex. Cerebral cortex. There are at least 10 medicine that can go to the cerebral cortex to help to connect the cerebral and the limbic. I always use this as a limbic. This is cerebral. So cerebral and limbic must connect. When connect, you can ride the horse. Gangnam Style. When disconnect, you're in trouble. You're in trouble. So don't ever think that you need to be totally disconnected before you see a psychiatrist. Even a little bit of disconnection, you can't sleep well. You are feeling a bit suspicious of people. You feel that the people around you are not friendly. You can't concentrate, you have loss of interest, please come forward. The earlier we fix it for you, the better it is. The earlier we connect for you, the better it is. So stigma, okay, it's so much better now. I can tell you as a trainee in the early 80s, late 70s, there was only one mental hospital, and it was called Woodbridge Hospital.
Oh, yes.
2,000 patients, 2,000 patients in a mental hospital. Then they realized that we can't just have one mental hospital. Then they started to have psychiatric wards in general hospital. Now you have psychiatric wards in Tan Tock Seng, in Changi General, even in Sengkang, Khoo Teck Puat, SGH, NUH. You have psychiatric facilities all over the island. And even some polyclinics specialize in helping people with mental problems. So you can see that it is much better than last time. People are coming forward, and you don't have to go to Woodbridge. It's now called Institute of Mental Health. That's for very serious patients who need institutional care. For the rest, if you don't want to go to institution, you can go to a polyclinic, you can go to a general hospital. And of course, you can go to a private setup if you want. So all these are, in my opinion, a movement in the right direction. Movement in the right direction. So we hope that people can realize that it is okay to see a psychiatrist, discuss with a psychiatrist, and focus on mental wellness. It's not just on mental illness. Dr. Ang, how can I be mentally sound? How can I fix my 4 legs? Especially the mental leg, help me fix the mental leg. Yesterday, I saw a patient was previously seen by 2 other psychiatrists for over a few years, was on at least 5 antidepressants and not recovering. So a friend said, go and have a session with Dr. Ang. So after 1 hour, I told him, you have an undiagnosed Asperger syndrome. Undiagnosed, wasn't picked up. So I say Asperger is not a mental illness. Asperger is a developmental problem. It's high functioning autistic spectrum disorder, right? ASD. Now they call it ASD, high functioning ASD. But he was actually having most of the features of Asperger. And when he came with his partner, when his partner realized that it's Asperger, there was a sigh of relief. Finally, it makes a lot of sense to the partner. After 5 antidepressants, still can't recover. After X number of years with 2 psychiatrists, still cannot recover. So then they realize a lot is the developmental part of the brain not well developed. Asperger is a form of mild autism, high functioning autism. They have difficulty socializing, but they are damn intelligent. They have a lot of ideas. They can do a lot of things, but they cannot initiate. They have difficulty initiating. They can be COO, but difficult to be CEO. CEO need to initiate, need to have initiative. But once someone initiate for them, they can be very loyal workers, very good workers, and very dedicated, hardworking as well. So my point to him is that you don't really have a mental illness. What you have is a developmental problem. Fix it, change for the better. So mindfulness is one way of helping you to connect your limbic and cerebral, and then you can overcome your Asperger. There are many famous Asperger doing very well in life.
Yes, absolutely. Well, actually, this
So there's one.
Sorry, please continue.
I have a book called Driven to Distraction. This is a very good book by Edward Hallowell. Who is Edward Hallowell? He is a psychiatrist. He did not know he's got attention deficit disorder until 31 years old.
Oh, wow.
Until 31 years old. So many of us may be walking around with undiagnosed ADD, undiagnosed Asperger, undiagnosed problem. He was attending a lecture when he was undergoing training to be a psychiatrist. And the lecture was on attention deficit disorder. Then Edward Hallowell said, that's me. The lecturer is talking about me. And he went on to be world famous. He went on to write at least 20 books on ADD. So he's a famous example of a man who didn't know he's got ADD until 31 years old. And once he knew it, it transformed his life. He famously now say, he has written the latest book, ADHD version 2, 2.0. And he famously say, people with ADHD have a Ferrari engine for the brain, but bicycle brake. They have a lot of they have a lot of ideas, and many people with ADHD are entrepreneur. They do a lot, they develop a lot, they're innovative. They're very innovative. Bill Gates developed ADHD when he was 11 years old, went to see a psychiatrist for a year and a half and learned so many things from the psychiatrist. How to look at things differently, how to focus appropriately. So Jeremy is very good, very useful for me to tell people, don't be shy. You may have an undiagnosed problem. Bill Gates proudly say, I went to see a psychiatrist when I was 11, right? And then Lady Gaga now, I went to see a psychiatrist. Prince Harry say, I was chaotic from 28 to 31 years old. Now I'm better now because I went for therapy. I went for all kinds of therapy. So one of my jobs is to have famous people, celebrities, talking about their mental health problem and proudly share with Singaporeans, don't be shy. If Lady Gaga can tell the world she's seeing a psychiatrist, what's there to be shy about? So the stigma, I think eventually one day will go away. What I'm concerned about is undiagnosed problem. I saw one yesterday, and I believe there are many out there undiagnosed because they don't think they have a problem, but they are giving people around them a lot of problems.
Yes. Well, actually, that's actually a good way to lead out to the next question that a lot of students actually asked, which is how can they identify when or if they need to seek professional help? Because I think that from their perspective, it's actually a really good question. Because like you said, like there are some things about understanding and accepting that we have certain personality traits that maybe I'm a little bit more inflexible than someone who's more adaptable. But what is that boundary that goes from me being adaptable or inflexible to becoming something that I need to seek medical treatment for?
Only one word. One word. And that word is functioning. If you like adaptability, Dr. Kang, Shimini Kang, this morning I told you, right?
Yes.
I heard 2 TED Talks. And one of the TED Talk is one awesome skill that you need to have is adaptability or adaptation. Yeah. And if you find yourself not able to adapt, you go to a workplace, a brand new workplace, you find that you can't do your work, you can't get along with your colleagues. And then when you go home, what happens? You can't sleep. You can't eat properly. You can't concentrate. You become very hot-tempered. You kick your cat, you kick your dog. You're no longer functioning. And family members can notice a change in you. The second word is change. Change in you. He's normally very even-tempered. No? Why lately very hot-tempered? Change is the second word. First word is functioning, /adaptability. Second is change. If you have always been hot-tempered, you continue to be hot-tempered, no change. It's your personality, no change. But if you have been eating well, sleeping well, suddenly not eating well, not sleeping well, that means you are troubled. And one of your troubles could be you're not adapting to your new workplace. You have a difficult boss. You're not adapting to the style of this new boss. And therefore, when you don't adapt, you don't function. And when you can't function, it will show in terms of, remember the 3 things you need to do: eat well, sleep well, and breathe well.
Yes.
You are so tense. You can't even, you have shortness of breath. You can't even breathe well. No? Right? That's the meaning of panic. Panic is when you have shortness of breath, you can't even breathe well. So that is an overall view. No? You look out for people who can't adapt and people who have change in their behavior. Or you yourself notice you can't cope, you can't adapt, and then you have a change in your behavior. Lately, I've been defining stress in this way. Everywhere we face stress. Stress is what we call ever present. Nobody is free from stress. Everywhere, especially now, COVID-19.
Oh, yes.
Don't know when is it going to end. So everywhere, stress is everywhere. It's impossible not to have stress. Right?
Yes.
So I now define anything that is doable is not stressful. Let's say I got many medical reports to write. Right? I know they're doable. I don't feel the stress. It's just a matter of finding time to do. If I know I'm giving this talk, I know what I want to share. I have the things I want to share. I know it's doable. Even though 2 hours I can handle. I don't feel the stress. But the moment I think it's not doable, the moment I feel that's beyond me, then I feel the stress. You get the idea? What is doable, which means functioning. If you can function, doable cannot be stressful. What is not doable can be a source of stress, which means things beyond your control, not doable. Let's say one of my medical reports involve talking to a lawyer. It's because it's a court case. And the lawyer insists on certain issues, right, which I'm not comfortable with. Right? So you find yourself in tension, yes. Temporary tension. That you can disturb you a bit. So I lately have been thinking, I've been telling all my patients, what is doable cannot stress you. What is not doable likely can stress you. Which means what? We must be on top of the problem. control the problem so that make sure it's doable. Whenever we smell something that's not doable, quickly convert it into doable thing. And if we can't, what do? We get help. People come and please come and help me. Please come and help me. Very interesting, right? So open our mouth, be mindful that this is beyond you now. Get people to help you. So lately I've been reflecting on what is doable cannot stress you. People are stressed when not doable, when they feel that it's beyond their control, when they know there's no hope, and when they feel there's no hope, and they feel helpless and hopeless, that's when they need a lot of help. And that's when they can do foolish things. We don't want them to do foolish things, you see.
Absolutely.
Okay, so that is my point about look out for change, look out for functioning. If someone is not functioning, there must be reason why the person is not functioning. Example, no, promotion can become stressful. No, you are good as a teacher. No, you don't want to do administrative work, then you're promoted to be vice principal or principal, right? Which is not your cup of tea. Eh? You'd rather teach than to be a school leader, right? So you find yourself having a different skill set, and you're not comfortable with the skill set. Then not doable.
Yes.
Not doable becomes stressful. Then you'll be shown in your behavior. Like giving a talk. I'm a doctor, I like to help and treat patients. I may not enjoy giving talk. So I may say, please don't get me involved in talking, I would rather see my patient. I'm more comfortable one-to-one. So it's our comfort level and whether doable or not. Anything not doable, we are in trouble. Then we ask for help.
Absolutely. That's actually great advice. Yes, understood. Actually, there was I was listening to a podcast just last week about mental resilience, and the podcast host, I can't remember his name, said the same exact thing as you. He said that how do you train mental resilience or protect mental resilience is that if you're feeling stressed out, very pressured about the tasks that you have to do, just list a column of what is within my control and what is not. Those that is not within my control, cancel it out, and you shouldn't be bothered by it. So that is excellent advice, Dr. Ang. I do not want to hold you up. So, sorry. Yes.
And lastly, put our own,
Yes.
We are not afraid of falling, Fall, get up, fall, get up, fall, get up. We are only afraid of not getting up. So when I say doable, doable means when I'm down, am I able to get up? Am I able to get up? If I can't get up, who can come and help me to get up? I always bring this out to show my patient. And this is my definition of resilience. Resilient. Nelson Mandela once said, judge me not by the number of times I fell. Judge me by the number of times I got up. Isn't that wonderful?
Yes, absolutely.
And there's a Japanese proverb, I fell 7 times, but I got up 8 times. Interesting.
Yes.
Because for one of the 4, you tried twice.
Yes.
You fell 7 times, how come you got up 8 times? Because for one of the 4, I tried twice. It's amazing, right? And that is wisdom. So wisdom come from experience, come from moving from an intelligent point of view to connecting the intellect and the emotion. And that is wisdom. That, remember, you can be very intelligent, so what?
Yes.
It's silver medal. You want to get gold medal, you must connect to your rest of your brain. This is gold. You get it?
Yes, absolutely.
So I don't want to be intelligent but not wise. I want to be intelligent and wise. And even if I'm wise but not intelligent, I'm still okay. I'm still functioning.
That's a very nice way to put it.
What's the point of being very intelligent but not wise and not functioning, right?
Absolutely, yes.
So it's all about connection. Connecting is so important. the more we learn to connect, the better we are. 2 weeks ago, I was at Takashimaya. I got some book voucher given to me by my patient, 3 book voucher, $10 each. So I was looking for a book to buy. I seldom buy book now, or e-book. I know I want to buy a physical book from Takashimaya. And I found one very good one. And it's called Your Wild and Only Life. Your Wild and Only Life. By Maureen, Maureen, Getfield, Gaffney. By Maureen Getfield. Came out last year only, right? 2020, 2021. Right? Your Wild and Only Life by Maureen Getfield. She's a psychologist. And she said 3 things. It's very heavily research-based. I nowadays go for evidence-based books. Not pull up your sock, tighten your belt. That kind of books never excite me. I want evidence. And she put it so well, you know. Life boils down to three points. CCA. CCA. Like our CCA.
Yeah, extracurricular activities. Yes.
What is the first C? Competence. Doable. Adaptation. Wow, I say, my goodness. How competent you are. From competence, you develop confidence, right? And then you have self-esteem. When you feel good, you do well, you want to grow and develop, right? Do, learn, grow. Do, learn, grow. And you look at my model. Doing is about competence. Do, learn, grow, right?
Yes.
So, C. Guess what is the second C? Connection. Connection. And my mindfulness is about connecting. Open mind connects, close mind clash.
Yeah.
I was so happy, you know, to a doctor or to a professional, when they see something that coincides with what they've been teaching, they feel very happy. Like when I saw the TED Talk today, wow, adaptability. I've been telling the world to adapt for so many decades, you know. Adapt.
Yes.
What's A? A, I thought it's adaptability. That's competence already. A is autonomy. Autonomy, freedom, choice, to do what you enjoy doing, to do what you like to do. Autonomy. And what is my mindfulness? When I do 5-finger mindfulness, I free you.
Oh, yeah.
I give you the freedom. This is trap. I don't want to be trapped. Trap, squeeze me. I got no options. I want to be free. Free, I got 5 options. I can fly. I can go anywhere I want. Wow, I see this. Competence, connection, and freedom. Autonomy, CCA. And with that note, I end my talk. That means many things are universal. Many things are commonsensical. But please put into practice. And how to put into practice? Do, learn, grow. Thank you very much.
Thank you so much for all your insight, Dr. Ang. So, you know, I just wanted to ask you one last quick question to end off our dialogue. And this one is a really good question for me because, you know, I'm a caregiver myself, as you know. We have a really thoughtful question from some of our peers, which is how can we better support those that are suffering through mental conditions?
Okay, very good question. And it depends very much on the age of the caregiver and your life station. Because I once treated a man with schizophrenia. And when he started to have the illness, all his children were very young, primary school. So I walked the journey with them. They are now all grown up, graduates and working. So you can see the difference between when they were very young and when they are adults. So the first point I would say is at what age you are as a caregiver. when they were in primary school, it was very difficult for them to comprehend what's going on. But as they grow older, they became clearer that this is a biological illness, nothing to do with the character of their father. It is a chemical imbalance that's going on in the brain. So it's a brain problem. So you can find their love for their father shifted tremendously when they understand the situation. So the more you understand what your family member is suffering from, the easier it is to practice mentalization. Put yourself in the person's shoes. Be mindful of the suffering of your family member. Secondly, have a lot of support from other caregivers. Very, very important, because you have a common topic and then you can talk about the topic and support each other. Mindful and transformational relationship with fellow caregivers. That's very important. Thirdly is education, social and psychoeducation. Educate the person with the illness and educate others who come into contact with the patient. Sometimes they don't understand, because mental illness, they also have a lot of distorted ideas in their own brain. So we have to help them clarify those views. So on the whole, it is tedious, but I think one reason is not measurable. The result sometimes can be very hard to obtain. I mean, if I have a bout of pneumonia, I'm in hospital, everybody send me a bouquet of flowers, I'm undergoing treatment. At the end of my antibiotic treatment, I recover.
Yes.
So there's an end point. But for mental illness, sometimes the end point is very hard to reach, especially for psychotic illnesses. Even for neurotic illnesses, the worriers remain worriers. Those who are anxious remain anxious. Very hard for them to completely recover.
Yes.
The bipolar, sometimes it's very hard for them to completely recover as well. They maintain their mood, either with medication or counseling. So with that note, I think caregiving is very stressful. Beware of caregivers burnout, and have a lot of support from fellow caregivers. And please, most important of all, take care of yourself first. You can't care for others unless you care for yourself. So we talked about self-care just now. Self-care is so important. So with that note, I think that's what I have to say for people who are caring for others with mental illness.
Great. Well, thank you so much for your advice and input, Dr. Ang. So, our conversations is always insightful as always, and I'm sure that our peers will find this dialogue to be really very helpful. So for everyone who's interested, you can follow Dr. Ang on Instagram and on LinkedIn as well. And with that being said, thank you so much again, Dr. Ang, for taking your time. And I really hope that you enjoyed yourself as well.
Okay, of course, 2 hours, 2 solid hours.
Thank you.
Pleasure is a pleasure. Thank you for organizing this. Thank you very much.
Thank you.